Welcome to the Project Management for Nurses series. Part 4 of Building a Quality Improvement Project Charter. This video continues the development of the Healthcare Quality Improvement Project Charter. Viewers will explore stakeholder management and developing a successful project team.
Okay. Let me see where we are at with the project charter. Project goals. Check. Expected outcomes and benefits. Check. Measures and evaluation. Check. I have identified the quality improvement project team that will work together to achieve the project outcomes. Sarah and Carmen are our two community health workers who will be working with the Hispanic clients. Sarah and Carmen will receive training on the Familias Sanas model and will provide nutritional information for all families who are clients of the clinic. If a woman and her family are not enrolled in the FQHC but would like to receive healthcare there, the community health workers will assist with the paperwork and collection of documents, as well as make sure an initial visit appointment is set up. Sarah and Carmen will be assigned to the pregnant or postnatal Hispanic women involved in the project, and will attend all their appointments at the clinic. As both Sarah and Carmen are fluent in Spanish and English, they may be needed to provide translation services at clinic visits. Marjorie and Anna are clinic nurses who expressed an interest in participating in the Quality Improvement Project. The nurses will be trained on Familias Sanas and baby talk models, as well as receive specialized education on lactation support. The nurses will plan and run the baby talk sessions twice a year. Marjorie and Anna will be assigned to a Hispanic pregnant or postnatal client and be present at their clinic visits with the nurse midwife or clinic physician. The nurses are also responsible for documenting the data in the database designed for the project. If the care team identifies the need for the client to access community resources, the nurses are responsible for making referrals and following up with the client. April is the clinic certified nurse midwife and will provide pregnancy and postnatal care for the clients. April may consult with one of the clinic physicians, or refer to specialists such as an obstetrician if the woman has complex needs, or a pediatrician for the newborn. Jonas is the clinic IT specialist and will help support the data collection located on the clinic intranet. Jonas will be responsible for ensuring security of the data and setting up password requirements for the project data to maintain confidentiality. The final member of the quality improvement team is Maria, the front office manager. Maria's team helps to enroll families into the FQHC and will work with the community health workers to accomplish this. Maria will ask her staff to ensure appointment reminder phone calls are made to the Hispanic women included in the project, and to collect data that could reflect that the project is interfering with the scheduling of other FQHC clients. When I met with Juanita and Dr. Gomez, we identified the stakeholders involved in the quality improvement project. These are stakeholders both internal and external to the FQHC. Using a stakeholder matrix, I can determine the level of interest and influence of the stakeholders in the project. The stakeholders who have low interest and low influence in the project are other local health providers and the residents of the county. A communication will go out to these groups informing them of what the FQHC will be doing in the quality improvement project. A stakeholder who has low interest but high influence in the activities of the project is the local transportation company, as this resource is important to get many clients to the clinic for visits. Local churches where our pregnant and postnatal Hispanic women attend services could also encourage women to participate in the Baby Talk program and attend scheduled clinic visits. The project team will inform and consult with these stakeholders to identify and address barriers to participation in the project. Stakeholders who have high interest and low influence include the local health department, County Department of Social Services, local food banks and community gardens, and local WIC programs. For these stakeholders, the project team will inform and consult to identify how to remove barriers and improve health promotion. Finally, Our stakeholders who have high interest and high influence in the project include the Hispanic community, the clinic board, other providers and staff in the clinic, obstetricians and pediatricians that provide care to our clients, the regional labor and delivery hospital unit and birthing centers, local Hispanic cultural center, and mental health and substance use disorder specialists. The project team will inform, consult, and collaborate with these stakeholders for project success in improving the care of pregnant and postnatal Hispanic women. I am excited to be working with you all on this quality improvement project. We have earlier discussed the current clinical problem and the activities that we will use to address the needs of pregnant and postpartum Hispanic women and newborns. The meeting today is for us to discuss how we will work together and the best way to communicate with each other. I would like to ask everyone to contribute to this discussion.
Since I look after most of the pregnancy and postpartum clients that attend the clinic, I can realistically only attend one meeting a week. I will do my best to attend, but if I need to attend a delivery, I may not always be able to come. Can we try for Fridays at noon?
That time would work well for the nurses as we have a nursing staff meeting that is normally scheduled on Fridays from 2 to 4 in the afternoon. I hope no one minds if I am eating lunch during our meeting.
That should work for Carmen and me as well. We are normally here at the clinic on Friday afternoons, planning our outreach for the next week.
I will put a meeting break for 1.5 hours into everyone's blocks for Friday afternoons so it is protected time, and the front office does not accidentally book a client in for an appointment.
Great. We have a regular scheduled meeting time. One item I need to make sure that we all understand is that while we are working as a team, it is important that everyone practices to their scope and licensure. Juanita wanted to make sure everyone knows who they will report to with problems. Sarah and Carmen, if there are any client problems you need to discuss, go to Marjorie and Anna to problem solve. Marjorie and Anna will go to April with any questions related to the Hispanic client's pregnancy or postpartum issues, and to Dr. Gomez for any other health-related issue. April will report to Dr. Gomez on any concerns she has about the clients, and will make any necessary referrals to obstetrics or pediatrics.
Thanks for outlining the reporting structure, Andrew. I was wondering how that was going to work. One request that I have is that the nurses and providers use as little medical terminology as possible when discussing the pregnancy and post-delivery care and problems. As a health promoter, I am still getting to know more about my role talking about nutrition during pregnancy and after the baby is born. Using a lot of technical words really gets me confused on what is going on with the client and what I am supposed to do to help.
Thanks for that request, Carmen. It is important that you and Sarah contribute to the care of these clients. How language is used in the team is important.
Andrew, I would like make suggestions about how to manage communications within the team. As I have learned from helping other organizations run projects, not having a developed communication structure can lead to some big issues and misunderstandings amongst the team members. As April may not be able to attend all weekly meetings since she may be doing a delivery, it is important that we have a strong communication strategy, so she feels like she is always in the loop.
Thanks for bringing this up, Jonas. I was wondering how I was going to catch up if I missed meetings.
I am putting in our clinic intranet a separate drive just for the project team communications and documentation. Since everyone is busy performing their duties, having a place where electronic messages can be housed for the team is important, so there is a history of what was said and done. I would encourage the team members to use this tool to email each other questions and problem solve, so everyone else can see what is happening. If you do have a private conversation, please provide a summary of this conversation in the electronic drive. Weekly meetings should have minutes, and these will be stored in the project drive along with any other documents used for the project. All client information documented in the medical records will stay in the clinic EHR so they are secure. There will be data sheets that collect aggregate information that will need to be completed by Sarah and Carmen, and Marjorie and Anna.
Thanks, Jonas, for developing these communication tools for the team. If anyone is having trouble accessing the drive with the unique password provided to you, please reach out to Jonas for help. Since we are trying something new, brainstorming is encouraged to problem solve. All team members will have different ideas that we can use to overcome challenges that come up during the next year of the project. Since we all come from such different backgrounds and experiences, please keep an open mind about new ideas. Of course, we should all be treating each other with dignity and respect for what we each bring to this project.
I am really excited about what we can do together as a team. Andrew, thanks for asking us to participate in this project. I look forward to meeting with everyone next week so we can finish the Quality Improvement Project Charter. This concludes Part 4 of the Project Management for Nurses series on quality improvement projects. In this video, the viewer discussed stakeholder management and building a successful project team. Part 5 will examine quality improvement project assumptions, constraints, and risk management.